We're always young. Young because we are trained, for example, in an institutional environment, and many of the things we do are according to a process and protocol. But when you get to the community, any community, rental flats community in Singapore, a rural community that I used to work with, then there's no protocol. Or you have your own protocol, but the family, the residents, the patients, the farmers, they don't live their life according to your protocol. So I enter a village with a protocol for typhoid prevention. I enter a village with a protocol for diabetes control. I have to find ways of redesigning my approach to be community-centric. It has to be their protocol, their way of life. It should be seen through their priorities. That's when I found that it was tough, because I wanted them to obey me because I'm the doctor and they appreciate me. If I force my way, they would obey me for a day or two, then it gets lost. So the challenge and the beauty of community health is to get into a community, celebrate with them their life, connect with them, and help them take ownership of the healthcare issues that they face. To me, medical training, healthcare education is a privilege. So from being a medical student, and my wife's an accountant, we had purpose and prayed and dreamt of the day we'll work among the poor. So attitude counts. Of course, when you go into a new community, there are differences. For example, when I went to Sichuan Bana in Yunnan, this is in the 1990s, they have a great water festival like Songkran in Thailand. And then we enjoyed the water festival. It was color, water splashing, dance, fireworks. Then next day, there was no water. And we say, what happened, no water? They say, yesterday water festival, what? We used all the water, celebrate to the fullest. We're like, okay, what happens now? And they say, okay, you take your pail and walk down the street, there's a standpipe, you can get water. And sure enough, there was water. And so I had to carry 2 pails and go and get water. But there was one problem. In the line of 20 people collecting water, I was the only man. The rest were ladies, because in their culture, ladies carry the water. And they look at me, they say, why are you here? I say, collect water. They say, where's your wife? I say, my wife used to be university lecturer. She don't know how to carry water. And she was like, you poor thing, you marry a wife that cannot carry water. I say, my wife very smart one. Yeah, but she cannot carry water. So the challenges of moving into a different society is that we have to adjust our style, our culture, and the most difficult thing I would say wasn't poverty. Most difficult thing was learn to listen all over again to the pulse, the priority, and the peoples of the community you go with. Uncertainty. Uncertainty is because we come from a very time-based society. And there you move into a season-based, seasonal. So I can organize the same maternal and child health program, and the outcomes during the harvest season, the rice planting season, the cold season, all very different. Same program, but because it's seasonal, the participation and the problems we face are different. So I wasn't clued to that. So there was an uncertainty. For example, I once organized an infectious disease course, and I thought winter the farmers are quite free. You see, my students, my village doctors are part-time. They are part-time health workers, full-time farmers. In the very remote areas of Yunnan in those days, there will be only a few people who can read and write, and they will be appointed as the village health workers. They can stitch, they can give vaccination, some can even deliver babies, but they are semi-literate and they are full-time farmers. So I thought winter time, very cold, no planting, they could come for my infectious disease class, right? They didn't, you know. And I was wondering why. See, these are humble folks and they are very gentle people. These are the hill tribes or the minority少数民族 of Yunnan in China. And I discovered why. One young couple came up to me and said, look, and the man said, I just got married, and in your criteria of coming to class, you say you must bring your own blanket and beddings. Because I went there with a Singapore mindset, I'm here to train village doctors. I'm not here to provide beddings. So I said, just bring your own beddings, right? Because after the course of a 3-week course, I didn't want to be in charge of washing, and I just want to teach medicine. And then he says, winter time is very cold. I said, yeah, I know it's very cold. It's 5 degrees. It's very cold when there's no heating. The wind blows through a wooden bamboo house. It's very cold. I just got married recently, and in my household, we only have one blanket. So if I come for the training with my one blanket, my wife will be freeze. So it's like, whoa, back to square one, replan again. Things I assume will work because curriculum is good, teaching point is good, equipment is there, and it should be go, right? And I realized that these are things that I have to learn to listen to the pulse or just the heartbeat of the people. Okay. We are healthcare personnel. We go there because we understand that things can be better. Up in the mountains, sometimes I get backpackers, often Westerners, who come into this pristine culture of a minority ethnic group, bamboo house, cooking over a wooden fire. And there's a little debate going on, say, why should you bring outside changes to this pristine environment? Wow, pristine, very high infant mortality rates, mothers dying at childbirth, malnourished children. I say there's nothing pristine or so pristine about high disease, morbidity and mortality and morbidity. So we know our data. Okay, it's not that culture rules everything. We know our data, and we just want to go in, live with them, find out the reasons why they are like that, look for solutions within the community. What in development terms is called ABCD, asset-based community development. So we don't try to parachute in all kinds of new ideas, medicine, machinery, technology, but we discover the changes along the way. And so this is the pathway of sustainable development. We want to be with them, earn the right to listen, and then discover ways of overcoming the challenges with them. In Singapore, I think we are also moving towards that in a very urban way. We used to talk a lot about healthcare and healthcare costs, healthcare personnel, healthcare economics. And now Singapore, the thinking is, we're not into healthcare, we're into health. And that is it, we are into health. We want to get people moving, people functional. We want to get families together in health. The provision of healthcare is to support health. It's always difficult to work with people, and the most difficult person to work with is me. It's always beautiful to work with people, and the most beautiful person to work with is the person sitting before you. Yeah, it's always difficult to work with people. Okay, so it takes a lifetime of learning, of training, of understanding, and being a bit wiser. Yes, it's difficult to work with people, not because I'm from a foreign country, but maybe because we are from Singapore, because we are agenda driven, and rural communities tend to be relational, more relational. So we have to learn to balance a bit. they don't want us to go there to be totally like them, because they receive you with the expectation that you can contribute in a nice way, bracket, in a humble way, to their livelihood. I had a good mentor who told me there is no healthy person without a healthy environment. There's no healthy people without a healthy environment. And that was true even in rural communities. So one thing that I enjoyed doing, because also my kids were with me, my mother also took part, and whenever Singaporean teams came, I got them to do, instead of giving out balloons, instead of doing more sketches to entertain them, we went to plant trees. So wherever we went, whether it's at a local township hospital, in a village doctor home, in a church, in a school, in a park, we actually planted trees, local trees, fruit trees, and we share with them, okay? They know that planting trees are important. Then very strange that you ask them, are planting trees important? Have you planted before? No. Why not? I don't know where to get trees. Then you discover that poverty is often a poverty of knowledge. Down the road, there could be a place where the government actually runs a tree planting program. So we planted trees. And there was one leprosy rehab village that we went to. It was very poor. And yes, we looked after the wounds, we gave them vitamins, we helped to adjust their pots and pans so that the handles will not burn them. Leprosy, they get burned because they don't feel. We put padding on their shoes so that they don't get foot ulcers. We did all these things. But leprosy, one of the problems is they don't feel in their eyes, and the repeated dust. When you and I get dust in our eyes, we will blink, tears come out, and the dust get washed away. In leprosy affected patients, they don't feel, so they get repeated corneal ulcers, and then they go blind. So we went to this village and realized that, yes, we gave sunglasses, we did all sorts of things, and we realized that if we planted rows and rows of trees, especially on the windward side, on the road, when the wind blows, there will be less dust coming into the village. So we planted hundreds of trees, and they're very small. I'm so glad that now, when I visit, there's a whole row of beautiful trees, and the trees block the wind, the trees bring moisture, the grass, the leaves can be used to feed the goats. All sorts of good things happen. So I would advocate, plant a tree. That is a very sustainable community engagement. And why we started with planting trees, because also I know nothing about planting trees. When you enter a village as the expert, they tend to put on a docile attitude. But we started out planting trees, and it shows very quickly that they know how to plant trees much better than me. And so they will show me the way. It is a nice way of reducing the power inequality. And as they taught me how to plant trees, then we have drinks, then we have lunch, then I taught them how to take care of themselves. It was a nicer way of doing it. Ideally, even in Singapore or anywhere, the patient should take a fair amount of ownership for his medical issue. In an emergency, CPR, I take over. But in a chronic illness, or even in an illness that needs a certain length of intervention, it's a skill of the doctor to find out where the patient is. Okay. What are their fears, what are their hopes, what are their priorities, and then work along from there. It's quite easy to come in and sit down 3 minutes and dish out some medication. It happens most of the time. But when the patient is resistant, you've got to find out why. And so if a patient doesn't want treatment, medical ethics wise says, I can't force a treatment on them. But then to be really his or her physician, the understanding, the empathy often wins them over. I'm not an expert. I'm a small town person. I work in a small village. And so, are there, and all this question of when should you receive foreign aid? On one hand, everybody wants the most handout. But in a more sober moment, they will realize that education and jobs are what they want. Sustainability. Everybody knows that handout non-sustainable. So education is what they want, and then employment or vocation is what they want in the long run. So rather than talking about how much aid can I bring, we really talk about are the young people getting educated? That is the formal education. In the community, we ask, are we learning? Okay. And then I often talk to them about jobs, about employment. For example, China has shifted a lot. In the 80s, a village man could go into town and be a road sweeper or security guard and earn enough money to send back to build a house. But then cost of living rose, wages stagnated. Okay. Cost of living rose, wages stagnated. So the same person in the year 2020 goes to the city, be a driver or security guard. He may not be earning enough money even to feed himself, much less to send back to the village. So the realities have changed. And so we try to tell the villagers, look, okay, we got to find ways to re-educate ourselves. In my simplicity, I say, you have to raise your farm produce, okay, such that your farm produce becomes higher quality, better sales, and maybe farm skills will be much needed in future. Now this is a big culture change for them, because the whole drive is to go and get rich in the city. But I'm not so sure you can go and get rich in the city so easily anymore. So education, employment, these are as a doctor, I'm not just curing a disease, especially of a young person or middle-aged person. I'm helping him to get better so that his work is purposeful and meaningful. We need to be generous. There are impoverished communities out there, but we should be going into impoverished community with the idea that there are local resources that we need to use and use wisely, which I referred to just now as asset-based community development. Even in a disaster, say an earthquake or huge typhoon comes and sweeps an area, and you and I will know that in the immediate there's rescue and that's much needed. Then people bring in emergency supplies. Then a few days later you'll watch in the news, oh, the next stage is to prevent the spread of infectious disease, right? All the fractures have been evacuated, traumatic injuries dealt with, and tents were set up. The next stage is to watch for infectious disease, especially post-floods, post-typhoons. Very good. Then what do we see on the news? We will see volunteers, emergency team in full PPE, going around spraying. You know, they wear masks, they wear visors, and they go around spray, and then the news report, and the authorities are taking action to prevent the spread of infectious disease. When I see that, I say, wow, that makes the local population totally passive. Because I am a villager, I don't have PPE, I don't have a mask, I don't have that machine. What am I going to do? After a week, after 10 days, you were kind-hearted enough to come, but you have to go back. So in that setting, I imagine that 5 days post-trauma, post-disaster, when we go in to do we should go in with a listening ear. So I imagine that I would sit around with the teachers or the homemakers or the imams or the housewives and say, look, these things have happened. Yes, the government has given some tents and it's tough, but we are living there for the next month. What do you think you should do or we should do together to prevent infectious disease? And someone may say, we need to boil water. Someone may say, we need proper toilets. And the next question is, oh, what do you need to boil water? Kettle, stove, kerosene stove, central boiling system, or what do you need for the toilets? And I tell you, it's a strange thing. I learned this in Yunnan. When we went to build toilets, say in schools or village toilets, because they say gender equality, right? 男女平等. If you have 10 square meters for the toilet, 5 square meters for the girls, and 5 square meters for the men. I scratch my head. I say, no, why not? I say we should make 6 or 7 square meters for the women and 3 square meters for the men. Everybody say, no, you have equality, you know. I say, yeah, equality. I ask the men. It's not all about altruism. Then I ask the men, you know, you go out on tours and shopping, and both husband and wife got to go toilet. What happens? Yeah, we end up waiting for the women folk. I say, see, if for your own sake, why don't you give more toilets to the women? 有道理. See, so when we talk about even that, we have to bring the idea that function is more important than just layout and structure. Even in Singapore, I'm advocate of exercise. Even if you go to East Coast Park where we are nearby, I suspect that the men toilet and the female toilet are equal in size. If you really want the women to exercise, I was thinking, maybe you should have more women toilets. And not only that, if I have 10 labor hours to clean toilets every day, 7 should be for the women toilet and 3 for the men toilet. Why? I mean, generally a guy can tolerate a slightly dirty toilet and still want to exercise. But to ask a lady in Singapore to tolerate a dirty toilet and exercise, maybe the rates go down. So in terms of achieving the function, I realized that we need to think about a process all over again. So if I were go in and hand out money, and because I hand out money, I do things, spray chemicals chemicals cost a lot to reduce disease and go away thinking that I've done the job. I have not brought the locals as stakeholders into solving the problem. My family and I went to Yunnan in 1996. Sometimes we in Singapore forget and take this for granted. It's a great privilege to have a Singapore passport, and let's work to keep it so. So we are very welcomed by the Yunnan government, and we are very well received. They supported us in our work so much, not just because we are Singaporeans, because the need at the village level was very real. After all the ceremonies and ribbon cutting, I remember up in Sichuan-Bana. Sichuan-Bana is a Thai-speaking part of China where we were. Sipsong-Bana, you know, Neng, Song, Sam, Si, Hao, Chek Pek. It's the origin of Thai people. So after all the ceremonies were over, there was an Aka. Aka is a minority hill tribes. And he came up to me and he welcomed me. His name was Li Kang. And he says, thank you for coming. I said, why do you say that? He says, I'm a health official, he had a master's in public health. But he says, you know, I'm Aka, true-born Aka, lived in the mountains. And I never had a pair of trousers till I was 9 years old. The villagers are very poor. Please come. Wow, effective contributors in global health. I would say that as long as we are learners, we will be good contributors. Okay, so go with a learning heart. That's number one. When you are grateful, you are helpful. So we should be going there to learn well and serve well. And if you learn well, you are serving well. if you serve well, actually you are learning well. It's two sides of the same coin. So I'm a bit wary of high-powered teams. They could come and be high-powered even in their attitude. Don't do that. Okay, so advance your career. So when you go there, be very clear about what you know and what you don't know. It's okay. We all, in healthcare especially, everybody is a learner. So at every stage, first year in healthcare, final year project, 3 years in the profession, it is wonderful to go into a different community with a learning heart and a serving heart. Don't do things that are beyond your confidence level, certainly beyond the legal level, but go there and build that relationship. And they appreciate to discover that you are learning the same things and you are facing the same struggles where you come from. Wow, who knows? Certainly we cannot travel, but the reality is there are foreign communities right at our doorsteps. Singapore has gone through it. I volunteer among migrant workers, and for a long time they were on the invisible side of our society. And we now learn that global health is also neighborhood health, that we can't ignore them. So we ignore them and COVID hits us as it hits them. So we, as a country, I think we have done remarkably well to now change our attitudes and care for the health of the migrant workers right here. So in some ways, we learn that global health is neighborhood health, and that may be a little positive thing that comes out of the pandemic. So we learn that we need to care for the migrant workers, not as people who are far away, but people living in our own land. That's number one. Number two, I think COVID has caused us to think in terms of relationships rather than in numbers. In the past, when we run projects, we were looking at numbers. How many surgeries? How many came for the talk? How many receive this new treatment? So in community health, because of COVID, now when I give a healthcare seminar, I'm reduced to 1:2, 1:3, 1:4, 1:5, personal coaching, more listening. In some way, there's a golden nugget in it. We have moved away from the blind chase for big numbers into a more relationship-based small group setting. And going forward, maybe this attitude of caring and listening for the person right in front of you could be something good that we bring away from the pandemic or post-pandemic. For Singapore, there are 3 areas that we should be exploring. Singapore is an amazing place in terms of healthcare, believe me. We're doing very well. One is among teenagers. When in the past, if I wore spectacles at primary school, I would be laughed at. If I wore braces at primary school, oh dear, I wouldn't go to school. People would laugh at me. So that is over. If a parent has children who needs glasses or who need braces or even have scoliosis, most parents know where to bring their kid to. But if a parent has a kid that is addicted to handphone games, or teenager that watches pornography, it's quite common. Or a teenager who's always tired. You ask him, so what do you want to do during school holidays? I get answers like, don't know, do nothing, I want to sleep. So we have to look to the mental health of our youth, of everybody, but of our youth in a different way. We are caring very well for the BMIs, obesity, malnourishment. We are looking very well. We are caring very well for myopia. We should keep that up. We are looking at scoliosis. But we need a whole integrated approach, both among educators and healthcare and social workers, to ask, where are our young people? Where is the zest? Where is the enthusiasm for life? And this is crucial. We all know Singapore, people are our only resource. And I do not know the statistics, but I just hope that I will meet less young people who are so tired and more young people who have a zest. And I think if healthcare professionals can research into that, come up with answers, diagnosis, I think that is a crucial need for Singapore. Well, the other group, all these are just personal anecdotes, would be better childcare for special needs kids. Special needs kids, if I want to enroll a special needs kids into a kindergarten in Singapore, not every kindergarten will take them. But actually, you think about it, at kindergarten level, kids are kids. You know, with some adjustment, more kindergartens could be equipped and should be open-minded enough to take in special needs kids. We tend to segregate them so early and so young. So I look forward to a time where our special needs kids can go to kindergartens as every other kid, somewhere that is near their house. So that is a healthcare need that I would look for. Thirdly, aging in place. Read about aging in place, a fascinating idea in Singapore where the elderly age within the community. Don't move to a nursing home, but beautiful. Singapore is beautiful for that. An elderly can go from his or her HDB flat down to the food court through a sheltered walkway on his motorized wheelchair. It's amazing mobility there. But if you observe among our daycare centers and the centers that organize Pilates and Zumba for the elderly, mostly the women are there. The men are not there. We have to find ways to help men, I'm 60 years old, to help men who are 60 years old begin to connect and reconnect with their community so that they will be healthy aging within their community. I'm just helping myself. Healthcare is a wonderful career. Okay, being a doctor is a privilege. I really enjoy being a doctor. I used to volunteer for extra cause because I enjoy doing it. I used to work on Christmas Eve, New Year's Eve, you know, and because that's what I signed up for. It's a privilege. Therein lies the problem. It can be so absorbing that it can take over everything. So have a good non-healthcare friend who tells you, maybe time out. So that's one. In terms of work, as a young healthcare staff, you'll be rotated through different disciplines. I would say, wherever you go, for the short term, learn to love what you do. Learn to love what you do. Whether it is a surgical posting, a palliative health care, mental health posting, may not be your inclination, but for the short term, learn to love what you do. What is given to you, learn to love it. Go to work with a smile. Okay? Learn to appreciate the colleagues around you. For the long term, learn to do what you love. Okay? I say this with caution because what you love may not earn you a lot of money. Okay? If you are drawn to do something because you love it, okay, and that thing is high paying, wonderful, you got a good combination. But don't just be drawn to it because it is high paying. Because at the end of your career, you may just feel a bit that shortchange. So short term, learn to do what you love. Long term, learn to love what you do. Oh, joke. Start again. So short term, learn to love what you are given to do. Long term, head towards doing something that you love. So my wife and I, we are privileged. I worked 8 to 10 years in Singapore in Ministry of Health hospitals, and then we planned for it, prayed about it, and then said, okay, we would time at 35 years old, thought we have gathered enough skills and experience to work in a rural, needy community. And so we went to Yunnan. We thought we would stay 3 to 5 years, but we were learning a lot. So we ended up staying 14 years. So I come back to Singapore and had the opportunity to relearn. I took a year. I went to study at the Lee Kuan Yew School of Policy, not because I wanted a degree, but because it gave me the opportunity to relearn. By then I had been away from Singapore for 15, 20 years, to relearn what Singapore was about, visiting communities, taking a different angle to learn. So it's a privilege. Healthcare professional gives you the privilege to serve and learn day in and day out. Take that privilege with a wonderful. Take that privilege well. Don't take it for granted. Oh, okay, you can be recorded. Well, we came from pretty low-income families. Both my wife and my studies were all paid for by bursary. So after graduation, we planned to live simply on a fairly comfortable budget. Okay, and we planned that at the end of our bond, I was bonded 8 years, that we would move to a low-income area. So we saved for it. So that's why partly it took us 10 years to go. Yunnan, the cost of living isn't high. Also, we had support from our church. We had support from medical fellowships in Singapore. And later on, when I taught in Kunming Medical University, they also started paying us. So plan for it, and you find that $1 in Singapore, you can stretch it very much over there. Now China may be less, but if you go to a needy community, you find that the cost of living isn't that high. It was a very tough moment. I've shared this, that when we landed, it was on a Silk airplane, Singapore to Kunming. The airfield was an airfield. We could go to the side of the runway to play. And I brought my little daughter to play in a sand pit by the runway. And as I watched the Silk airplane, the plane that brought us there, take off to go back to Singapore, I felt so sad. I said, where in this wilderness have I brought my family to? What have I done? And I wanted almost to reach out to the sky and drag the plane back and say, maybe take us home, or at least take my children home. That was quite scary. So there was a beginning, a sober beginning to the adventure. Aha moment then, when I saw my kids walk to school. So in Sichuan Bana, we live in a fruit orchard, real orchard, not orchard, real orchard. And my kids will walk to school through the orchard. As I said, I came from a low-income family. I live in a one-room HDB rented flat. And because it was a gang-infested area, I was not let out of the home. I had no money. My parents had no money to send me to kindergarten. The first day I went to school was primary 1. Primary 1, I was shocked. Never heard people, this is Singapore, I never heard people speak English before. Because no television. I didn't, what is this going on? I only spoke Teochew. Then the English teacher asked my name. I also don't know what's my name. Tan Lai Yong. I said, never heard of the name before. But my mother called me by my Cantonese name. So I remember asking my mother, why go to school? And she was saying, go to school to play. I said, wow, that's fascinating. Of course I want to go to school. And that's my attitude about going to school. It's always about going to play. And I shared the same attitude with my children. going to school, yes, you learn, you take exams, but really is to play. If I don't want you to play, I will homeschool you. Okay, don't have to sing Marikita, save a lot of time, no assembly, but I want you to go through all this so that you will grow up in a community. What is the aha moment? I would walk my kids to kindergarten. We walked through the orchard. My neighbors who look after the orchard had an elephant, a wonderful elephant. And my kids would walk past this elephant bringing a piece of apple or pick up a star fruit from the ground or bring a banana and give it to the elephant. And this huge elephant would be so happy, fondle, rub the head, play with our children, all for a banana, a piece of apple. I mean, the elephant eats 100 to 200 kilograms of food a day. Why would the elephant bother about a banana? And my kids love going to school because on the way they can play with the elephant and they will look forward to going to school. And that was an aha moment that I realized that it's a privilege that my Singaporean kids can have a memorable childhood. In Yunnan, I was privileged to work with a team that looked after and supported leprosy, ex-leprosy patients in leprosy rehab villages. And this was a deep lesson in listening. One day up in the mountains, our team visited the leprosy rehab and they could do many things. They dressed wounds, they treated eye infections, they modified kitchens to be safer. And towards the end of the day, they asked an elderly leprosy villager, "What can we do for you before we go?" And this man, he's half blind, very poor. He sat the team down on wooden benches in the courtyard. Yunnan winters are beautiful, it's kind of Mediterranean blue skies. We just sat there and then he limped back, back to his hut, which was made of wood and thatch. Inside there's nothing much, maybe some potatoes, some corn, his blanket actually made of sewn together with rags. And he came out, and he brought along his erhu. You know it's an erhu, right? And he sat the team down, and then he played his erhu. He played for about 2 minutes. After that, he stopped, and he cried, He says, "Thank you. That's all you need to do for me." He says, "For many years, nobody listened to my music, and now you listen to me. Thank you very much." So I think medicine and healthcare gives us a privilege of listening to mothers, to people who are dying, people who get well. Okay, we celebrate with them, we connect with them, and build a community that way. You ask me why I stay in Yunnan, because every other opportunity of service, it was also a learning lesson in listening, and that is so encouraging.